Question 1. While logging a freshly assembled 25-pound orthopedic tray into the computerized tracking system before sterilization, the SP technician knows this software primarily assists the department by performing which combined functions? A. Automatically downloading the latest infection control standards from regulatory agencies. B. Tracking instrument repair costs, linking sterile loads to patients, and managing technician workflow. C. Generating external recall notices for defective consumable supplies used in the prep area. D. Adjusting the facility's positive airflow and temperature settings in the sterile storage area. Correct answer B. Knowledge point explanation. Core rationale. Information technology in the sterile processing department serves multiple critical administrative and clinical roles. By scanning barcodes or RFID tags, the system provides financial management by tracking repair costs, demonstrates quality of care by linking specific sterilized items to patient records, and offers operational management by monitoring staff productivity and inventory levels. Trap analysis. Option A. Tracking systems manage internal inventory data, not external standard updates. This option would be correct if the scenario asked about the function of a professional organization's website. Option C. Product recalls are external communications from manufacturers handled by risk management or supply chain, not the internal instrument tracker. This option would be correct if the scenario asked about the FDA's MedWatch system. Option D. The tracking system monitors instruments, not environmental conditions. This option would be correct if the scenario described the building's HVAC control system. Concept extension. Modern tracking systems provide traceability which is essential for patient safety, especially during a recall event where a specific contaminated tray must be rapidly located. Question 2. When an SP technician notices thick smoke and flames coming from the electrical panel of a steam sterilizer, which immediate sequence of actions must they execute according to universal facility protocols? A. Activate the fire alarm, review the safety data sheet, put on a fluid-resistant gown, and attempt to extinguish the flames. B. Shut down the HVAC system, secure the decontamination area, document the incident, and wait for maintenance personnel. C. Rescue anyone in immediate danger, activate the pull station alarm, contain the fire by closing doors, and evacuate or extinguish. D. Evacuate the department immediately, call emergency services, and wait outside the building at a designated assembly point. Correct answer C. Knowledge point explanation. Core rationale. In a fire emergency, all healthcare personnel are trained to follow the RACE acronym to ensure a standardized and safe response. This stands for rescue individuals in danger, alarm the facility, contain the fire by closing doors and windows, and extinguish the fire if small enough or evacuate the area. Trap analysis. Option A. Reviewing chemical documents and donning gowns wastes critical time during an active fire. This option would be correct if the technician was responding to a minor chemical spill instead of a fire. Option B. HVAC shutdown might happen automatically or be handled by facilities engineering, but it is not the immediate first responder action. This option would be correct if describing the duties of the building maintenance team. Option D. Immediate evacuation without rescuing others or activating the alarm puts the rest of the hospital at risk. This option would be correct for a civilian in a non-healthcare setting who encounters an uncontrollable massive fire. Concept extension. If the technician decides the fire is small enough to extinguish, they must then utilize the pass method to operate the fire extinguisher effectively. Question 3. While working at the decontamination sink, an SP technician listens carefully to an operating room nurse's urgent phone request for a specific vascular retractor and uses that information to collaboratively prioritize the immediate workload. This behavior best demonstrates the practical application of A. Interactive human relations skills. B. Formal public speaking techniques. C. Cross-functional team governance. D. Standardized moral behavior protocols. Correct answer A. Knowledge point explanation. Core rationale. human relations skills involve the ability to communicate actively, listen effectively, and utilize shared information to build positive, functional working relationships. In this scenario, the technician uses two-way communication to understand the customer's needs and adjusts their physical tasks to support the surgical team. Trap analysis. Option B. Public speaking is a one-way communication method intended for an audience. This option would be correct if the technician was presenting an educational in-service on instrument care to a group of new hires. Option C. While interacting with the OR is cross-departmental, governance refers to administrative management structures. This option would be correct if department managers were forming a long-term committee to rewrite hospital policies. Option D. Moral behavior relates to ethics and distinguishing right from wrong. This option would be correct if the scenario involved a technician deciding whether to report a colleague who bypassed a critical sterilization step. Concept extension. Effective communication in the sterile processing department directly impacts patient outcomes by ensuring the right instruments are processed efficiently without causing delays in the operating room. Question 4. An SP supervisor is reviewing the daily digital logs on the department's dedicated instrument tracking monitor. Which of the following pieces of information will they not be able to extract from this specific localized system? A. The total number of custom orthopedic trays assembled by a designated technician during the morning shift. B. The historical frequency with which a delicate laparoscopic grasper has required repair. C. External manufacturer notifications regarding a defective batch of biological indicators. D. The specific patient chart linked to a terminally sterilized rigid container used in surgery. Correct answer C. Knowledge point explanation. Core Rationale. An internal instrument tracking system is designed to monitor the hospital's own inventory and workflow. It tracks productivity data, financial metrics like repair histories, and quality assurance links between trays and patients. It does not automatically receive or manage external product recall data from regulatory bodies or manufacturers. Trap analysis. Option A. Tracking staff productivity is a core operational function of the system. This option would be correct if asked to identify a primary feature of the software. Option B. Financial data including repair frequency is actively logged by tracking systems. This option would be correct if the scenario asked how the system assists in budgeting instrument replacements. Option D. Quality assurance and traceability to the patient level is the most vital safety feature of the tracking system. This option would be correct if asked what data must be retrieved during a hospital infection investigation. Concept extension. Product updates and recall alerts are typically managed by the supply chain or risk management departments utilizing different administrative databases linked directly to vendor notifications. Question 5. During a departmental shift huddle, the lead technician explains a new protocol for loading the low-temperature sterilizer. A newer technician raises their hand and asks a clarifying question about the proper spacing between Tyvek pouches. In the communication process, this question is a direct physical example of A. Formulating a communication barrier based on stereotyping. B. Providing active feedback to the sender. C. Initiating a new unlinked communication loop. D. Demonstrating the halo effect interpretation. Correct answer B. Knowledge point explanation. Core Rationale. Communication is a dynamic two-way cycle between a sender and a receiver. When the listener asks a question, they are sending a response back to the sender. This response is known as feedback, which confirms the message is being processed and helps to clarify any misunderstandings. Trap analysis. Option A. Stereotyping involves making assumptions about a person based on their group, which blocks communication. This option would be correct if the lead technician ignored the question because they assumed the new employee would not understand anyway. Option C. Asking a question about the current topic is part of the existing communication loop, not a new unlinked one. This option would be correct if the new technician completely changed the subject to ask about their lunch schedule. Option D. The halo effect is a bias where someone assumes a person is good at everything because they excel at one thing. This option would be correct if the technician assumed the lead was an expert in endoscopes just because they knew about sterilizers. Concept extension. Feedback is essential in a sterile processing environment because a misunderstood instruction regarding sterilization loading can lead to wet packs or failed biological indicators. Question 6. While mastering the daily operation and preventive maintenance of a newly installed automated endoscope reprocessor, a technician actively logs these new competencies into their training portfolio with the ultimate goal of applying for a supervisory role. This physical enhancement of their clinical skill set represents a fundamental component of A. Fulfilling the basic requirements for a routine daily shift assignment. B. Achieving mandatory annual certification renewals. C. Establishing a new cross-functional quality team. D. Pursuing upward professional career advancement. Correct answer D. Knowledge point explanation. Core rationale. Career advancement requires an individual to actively push beyond their current job description by learning new physical skills, mastering complex equipment, and seeking leadership qualifications. Mastering an automated endoscope reprocessor to build a resume directly supports moving upward in the sterile processing hierarchy. Trap analysis. Option A. Learning advanced equipment for a future promotion goes beyond basic daily requirements. This option would be correct if the technician was simply clocking in and sorting basic instrumentation at the decontamination sink as assigned. Option B. Promotion preparation is distinct from merely maintaining a current license. This option would be correct if the technician was sitting in a required bloodborne pathogen lecture just to earn continuing education units. Option C. This represents individual career growth, not team creation. This option would be correct if the technician was partnering with operating room nurses and infection preventionists to solve a departmental workflow bottleneck. Concept extension. Demonstrating initiative by volunteering for complex tasks, such as endoscope reprocessing, is a highly visible professional behavior that management looks for when selecting future departmental leaders. Question 7. Before loading the first surgical trays of the morning, an SP technician places a specific chemical indicator pack directly over the drain of an empty pre-vacuum steam sterilizer to verify that the chamber's air removal system is functioning effectively. Which specific evaluation is the technician executing? A. A biological lethality verification test. B. A Bowie-Dick daily performance test. C. An internal process challenge device evaluation. D. An external exposure validation check. Correct answer B. Knowledge point explanation. Core rationale. The Bowie-Dick test is a specialized Class II chemical indicator designed exclusively to detect air leaks and verify adequate air removal in dynamic air removal sterilizers. It must be run daily in an empty chamber, placed flat over the drain, which is the coldest spot in the sterilizer. Trap analysis. Option A. A Class II chemical indicator tests physical air removal, not the actual killing of microbial spores. This option would be correct if the technician was incubating a Geobacillus stereothermophilus vial. Option C. While a Bowie-Dick is a type of challenge device, an internal process challenge evaluation typically refers to monitoring the inside of actual loaded sets. This option would be correct if the technician was placing a Class 5 integrating indicator inside a dense 25-pound orthopedic tray. Option D. External validation checks whether a package has been processed, not the internal air removal mechanics of the chamber. This option would be correct if the technician was verifying the color change of indicator tape on the outside of a wrapped basin set. Concept extension. If a Bowie-Dick test fails, the sterilizer must immediately be taken out of service, and the technician must report the failure to maintenance for repair before any patient equipment can be processed. Question 8. After discovering a bioburden-contaminated rongeur inside a terminally sterilized tray delivered to the surgical suite, an SP supervisor leads a team backward through the entire physical workflow, asking why at the decontamination. prep, and sterilization stations to identify the fundamental breakdown. Which quality management tool is the supervisor utilizing? A. Proactive workflow risk assessment. B. Routine environmental quality monitoring. C. Failure mode and effects analysis. D. Reactive root cause analysis. Correct answer D. Knowledge point explanation. Core rationale. Root cause analysis is a reactive investigative tool used only after an adverse event or poor outcome has occurred. By repeatedly asking why the failure happened along the physical processing path, the team works backward to find and eliminate the original source of the error to prevent reoccurrence. Trap analysis. Option A. This event has already occurred, so the investigation cannot be proactive. This option would be correct if the team was evaluating the potential risks of a new brand of enzymatic detergent before purchasing it. Option B. Tracing a specific contaminated instrument is a targeted investigation, not routine monitoring. This option would be correct if the supervisor was simply checking the daily temperature and humidity logs in the sterile storage room. Option C. Failure mode and effects analysis is a forward-looking, proactive tool used to predict what might break down in the future. This option would be correct if the team was designing a brand new decontamination layout and predicting where cross-contamination could happen. Concept extension. A successful root cause analysis does not focus on blaming the technician who missed the bioburden, but rather focuses on fixing the system, such as replacing a burned-out light bulb at the inspection magnifier. Question 9. While rotating stock on the wire racks in the sterile storage room, a technician needs to verify the expiration dates on several different brands of commercially sterilized central venous catheter kits. Where exactly must the technician visually inspect to locate these specific dates? A. The upper right corner of the transparent plastic side of the packaging. B. The opaque backing of the medical-grade pouch material. C. The bottom left quadrant of the primary manufacturer label. D. Various unstandardized locations depending on the specific product manufacturer. Correct answer D. Knowledge point explanation. Core rationale. While medical device regulations dictate that an expiration date or a use-by date must be present on commercially sterilized packaging, there is no standardized, legally mandated physical placement for this data. Technicians must physically manipulate and inspect the entire package to locate the date. Trap analysis. Option A. There is no universal rule placing dates in the upper right corner. This option would be correct if a specific hospital's internal policy dictated exactly where their own staff must place lot control stickers on in-house peel pouches. Option B. Manufacturers print dates on various surfaces, not exclusively the opaque backing. This option would be correct if the scenario described the only acceptable surface for a sterile processing technician to use a felt tip marker on a paper plastic pouch. Option C. The bottom left quadrant is not a legally enforced standard location. This option would be correct if the technician was reading the specific instructions for use for one unique brand that consistently chose to place its dates there. Concept extension. When conducting physical inventory rotation, technicians must apply the first in, first out principle, which requires them to quickly adapt to finding expiration dates across dozens of different vendor packaging designs. Question 10. A patient brings their personally owned continuous positive airway pressure machine into the hospital for a multi-day admission. Before the nursing staff can plug this specific device into the wall and apply it to the patient, which designated professional must physically conduct the initial electrical safety and functional verification? A. A certified sterile processing technician. B. A biomedical engineering technician. C. An infection prevention committee member. D. A unit-based registered nurse. Correct answer B. Knowledge point explanation. Core rationale. Patient care equipment, especially electrically powered devices brought from outside the facility, carries a risk of electrical shock or malfunction. The biomedical engineering department is exclusively responsible for physically opening, testing, and clearing these devices for electrical safety before patient use. Trap analysis. Option A. Sterile processing cleans equipment but does not perform electronic circuitry checks. This option would be correct if the scenario asked who was responsible for wiping down the machine with a low-level disinfectant after the patient was discharged. Option C. Infection preventionists write the safety policies but do not perform mechanical or electrical inspections. This option would be correct if the scenario asked who writes the hospital's overarching protocol on whether outside devices are permitted inside the facility. Option D. Nurses operate the machinery but are not trained or certified to perform electrical safety clearances. This option would be correct if the scenario asked who adjusts the patient's oxygen flow rate while the machine is actively in use. Concept extension. Once biomedical engineering clears the device, they typically place a specific colored inspection tag on the power cord to physically signal to the nursing staff that the equipment is safe to plug in. Question 11. While manually scrubbing a complex orthopedic reamer submerged in a 110 degrees Fahrenheit sink, the SP technician encounters thick, yellowish adipose tissue that resists normal brushing. Which specific chemical additive must they dose into the soaking basin to actively target and dissolve this specific organic lipid accumulation? A. Protease enzyme detergents. B. Amylase enzyme formulations. C. Lipase enzyme solutions. D. General neutral pH surfactants. Correct answer C. Knowledge point explanation. Core rationale. Enzymatic detergents contain specific biological catalysts designed to break down specific types of complex organic soils found on surgical instruments. Lipase is the specific enzyme engineered to target, break down, and dissolve lipids, which include fats, bone marrow, and adipose tissue commonly found on orthopedic devices. Trap analysis. Option A. Protease enzymes specifically target and break down protein-based soils like blood and muscle tissue. This option would be correct if the technician was cleaning a hemostat coated in dried, crusted blood. Option B. Amylase enzymes specifically target and break down carbohydrates and starches. This option would be correct if the technician was reprocessing a flexible gastrointestinal endoscope containing starchy dietary residue. Option D. General neutral pH surfactants lower the surface tension of water to lift dirt but do not chemically dissolve fat molecules like an enzyme does. This option would be correct if the scenario asked for the baseline safe cleaning solution required for delicate stainless steel instruments. Concept extension. Because enzymes are proteins themselves, the water temperature must be carefully monitored using a thermometer, as water exceeding 140 degrees Fahrenheit will permanently destroy the enzyme's molecular structure. Question 12. While preparing a sealed transport container for a heavily soiled deep tissue bone biopsy trocar, the SP technician notes the presence of highly resistant microorganisms that actively multiply within the oxygen-deprived inner lumens of the device. How are these specific microorganisms scientifically classified based strictly on their physical environmental survival requirements? A. Aerobic microbes. B. Anaerobic bacteria. C. Disease-causing pathogens. D. Micron-measured spores. Correct answer B. Knowledge point explanation. Core rationale. In microbiology, organisms are classified by their metabolic requirements. Anaerobic bacteria are a specific classification of microorganisms that do not require oxygen to survive and multiply. In fact, atmospheric oxygen can be highly toxic to them, making deep puncture wounds or closed lumens their ideal breeding grounds. Trap analysis. Option A. Aerobic microbes require the presence of free oxygen to fuel their cellular respiration and survive. This option would be correct if the scenario described Mycobacterium tuberculosis thriving in the well-ventilated upper lobes of a patient's lungs. Option C. Pathogen is a broad umbrella term for any microorganism capable of causing disease, regardless of its oxygen requirements. This option would be correct if the scenario asked for the general term describing the target organisms of the entire sterilization process. Option D. A micron is a unit of measurement used to quantify the physical size of bacteria under a microscope, not their environmental survival traits. This option would be correct if the scenario asked how the physical filtration efficiency of a HEPA filter is mathematically rated. Concept extension. Clostridium tetani, which causes tetanus, is a classic example of an anaerobic bacterium that forms highly resistant spores, necessitating stringent sterilization parameters for surgical instruments. Question 13. An SP technician is carefully organizing freshly sterilized major abdominal trays inside a sterile storage room maintained at 72 degrees Fahrenheit, ensuring no unsterile surfaces breach the outer synthetic wrappers. The ultimate physical goal of these strict environmental and handling controls is to maintain the internal instruments in a state completely devoid of disease-causing microorganisms. What is the exact clinical term for this absolute state of being free from pathogens? A. Environmental infection control. B. Active infection prevention. C. Absolute asepsis. D. Healthcare-associated containment. Correct answer C. Knowledge point explanation. Core rationale. Asepsis is the literal medical term defining the complete absence of pathogenic microorganisms. By maintaining strict storage protocols and preventing package damage, the technician ensures the instruments remain in this absolute state of asepsis until they are presented to the sterile field in the operating room. Trap analysis. Option A. Infection control refers to the overarching hospital department or administrative program that dictates policy. This option would be correct if the scenario asked which administrative body audits the department's handwashing compliance rates. Option B. Infection prevention refers to the active, physical steps or actions taken by staff, not the resulting physical state of the instrument. This option would be correct if the scenario asked what procedural concept the technician was practicing by scrubbing their hands. Option D. Healthcare-associated infections are the negative patient outcomes the facility is trying to stop. This option would be correct if the scenario asked what epidemiological statistical metric the hospital tracks to measure the sterile processing department's success. Concept extension. Asepsis translates literally from its word elements, the prefix a meaning without, and the root sepsis meaning putrefaction or contamination. Question 14. An SP technician is meticulously inspecting the articulating joints of a robotic surgical arm under a lighted magnifier, confirming the complete absence of residual debris and ensuring flawless mechanical movement before packaging. By physically guaranteeing this highly complex device functions correctly during the upcoming 6-hour cardiac procedure, the technician directly contributes to which ultimate clinical outcome? A. A post-operative surgical site infection. B. An increase in operational procedural cost. C. Unplanned hospital legal liability. D. A sustained healthy patient recovery. Correct answer D. Knowledge point explanation. Core rationale. The foundational mission of the sterile processing department is patient safety. Providing the surgical team with instrumentation that is completely sterile, thoroughly clean, and mechanically functional directly prevents delays and infections, thereby directly facilitating a healthy and successful recovery for the surgical patient. Trap analysis. Option A. A surgical site infection is the catastrophic negative result of a processing failure. This option would be correct if the scenario described the technician negligently ignoring microscopic bone fragments inside the jaws of a rongeur. Option B. Increased cost is a negative administrative outcome caused by rework or delays. This option would be correct if the scenario described the technician dropping the sterile tray on the floor, requiring the surgical team to halt the procedure and request a replacement. Option C. Legal liability is the legal consequence of harming a patient through negligence. This option would be correct if the scenario described the facility being sued because an unsterilized implant was surgically placed into a patient's spine. Concept extension. Every physical task performed at the prep and pack table, from testing scissor sharpness to insulating electrosurgical cords, acts as a critical barrier protecting the patient from operating room complications. Question 15. While assembling a delicate vascular dissection set under the bright overhead lights of the prep station, an SP technician experiences intense visual glare reflecting off the highly polished surfaces of several newly purchased retractors. Which specific manufacturing term describes this highly reflective surface treatment that provides maximum corrosion resistance but causes severe eye fatigue? A. Satin metallic finish. B. Matte dull finish. C. Chemical passivation coating. D. Mirror surface finish. Correct answer D. Knowledge point explanation. Core rationale. Surgical instruments are manufactured with different surface finishes. A mirror finish is heavily polished to be extremely smooth and highly reflective. While this smoothness makes the instrument highly resistant to corrosion and staining, it heavily reflects operating room and prep area lighting, causing significant glare and eye strain for staff. Trap analysis. Option A. A satin finish is specifically brushed to be slightly dull, intentionally designed to reduce glare under bright lights. This option would be correct if the technician was examining a duller instrument that was easy to look at under the intense overhead beams. Option B. A matte finish is the dullest of all finishes, absorbing light completely. This option would be correct if the technician was preparing an ebonized, black-coated instrument explicitly designed for laser surgery to prevent dangerous beam reflection. Option C. Passivation is the chemical acid bath process used to build the protective chromium oxide layer, not the physical polishing of the surface texture. This option would be correct if the scenario asked what invisible chemical layer must be protected from abrasive metal brushes. Concept extension. Over time and repeated exposure to harsh detergents, a mirror finish can become cloudy or scratched, creating microcrevices where bioburden and rust can begin to accumulate. Question 16. When an SP technician loads a delicate surgical camera into a vaporized hydrogen peroxide sterilizer and initiates the low-temperature cycle, which specific safety tracking protocol must they physically implement to measure their chemical exposure limit? A. Clipping a specialized personal dosimeter badge directly to their scrub collar. B. Activating a wall-mounted continuous environmental gas detection sensor. C. Utilizing a combination of both individual badges and room alarm systems. D. Operating the equipment without any mandatory external exposure monitoring devices. Correct answer D. Knowledge point explanation. Core rationale. Vaporized hydrogen peroxide sterilizers are considered highly safe for staff because the chemical byproducts of the sterilization cycle are simply non-toxic water and oxygen. Because there is no toxic off-gassing, the Occupational Safety and Health Administration does not require the use of personal or area safety monitoring devices for this specific equipment. Trap analysis. Option A. Personal monitors are not required because the byproducts are harmless. This option would be correct if the technician was operating an ethylene oxide sterilizer, which utilizes highly toxic and carcinogenic gas requiring strict personal dosimetry. Option B. Area sensors are not mandated for vaporized hydrogen peroxide due to its safe degradation into water and oxygen. This option would be correct if the technician was securing the dedicated negative pressure room housing an active ethylene oxide sterilizer. Option C. Combining both methods is entirely unnecessary for this safe low-temperature method. This option would be correct if establishing the comprehensive facility safety monitoring program for a newly constructed ethylene oxide processing department. Concept extension. Although routine continuous monitoring is not required, technicians must still wear appropriate personal protective equipment, such as specific gloves, when handling the raw hydrogen peroxide cassettes prior to loading them into the machine. Question 17. While scanning the barcode of a finalized cardiovascular instrument set at the prep and pack workstation, the SP technician utilizes this computerized tracking system primarily to ensure which critical clinical outcome? A. Providing absolute traceability to support direct patient safety during potential recall events. B. Automatically updating the department's manual with the latest national regulatory guidelines. C. Physically locating the surgical patient's current room assignment within the medical facility. D. Transmitting immediate infection outbreak alerts to the local public health department. Correct answer A. Knowledge point explanation. Core rationale. Modern instrument tracking systems generate a digital record linking a specific tray to a specific sterilizer load and ultimately to a specific patient. This traceability is the most vital component of patient safety, allowing the sterile processing department to instantly identify and retrieve items if a biological indicator fails or a recall is issued. Trap analysis. Option B. Tracking systems manage internal operational data, not external industry literature. This option would be correct if the technician was navigating the official website of the Association for the Advancement of Medical Instrumentation to download a new document. Option C. The system tracks the physical location of instrument trays, not human patients. This option would be correct if a nurse was logging into the hospital's central electronic health record bed management software. Option D. Internal tracking systems do not communicate outward to external government agencies. This option would be correct if describing the automated reporting function of the facility's infection prevention epidemiology software. Concept extension. Beyond patient safety, these systems simultaneously provide crucial operational management tools, such as tracking staff productivity rates and monitoring how frequently specific scissors require sharpening. Question 18. When receiving a new supply delivery of highly flammable ethylene oxide cartridges, the SP technician must physically transport and secure these hazardous chemical containers into which specific storage environment? A. Inside a specialized and approved fire-resistant containment cabinet. B. On an uncovered wire rack located on the facility's exterior loading dock. C. Within a designated temperature-controlled biological refrigerator. D. Inside an incubation chamber maintained at exactly 75 degrees Fahrenheit. Correct answer A. Knowledge point explanation. Core rationale. Ethylene oxide is an extremely hazardous, toxic, and highly flammable gas used for low-temperature sterilization. To comply with strict fire and safety codes, technicians must store these individual cartridges inside a specifically engineered, approved containment locker to shield them from heat, impact, and potential ignition sources. Trap analysis. Option B. Hazardous chemicals must be strictly controlled indoors, protected from direct sunlight and extreme weather. This option would be correct if the technician was temporarily staging empty cardboard shipping boxes for recycling pickup. Option C. Ethylene oxide gas can become unstable if improperly chilled in a standard refrigerator. This option would be correct if the technician was storing a bulk delivery of temperature-sensitive pharmacological supplies. Option D. Exposing flammable cartridges to any direct heat source, such as a heated chamber, creates a severe explosion hazard. This option would be correct if the technician was placing a processed biological indicator vial into an incubator to check for spore growth. Concept extension. Facilities utilizing this gas must also maintain a dedicated, well-ventilated storage room featuring specialized exhaust systems to ensure any accidental leaks are immediately vented safely outside the building. Question 19. When an SP technician consistently reviews their assigned daily duties, arrives punctually, and meticulously executes all instrument assembly protocols exactly as outlined by the department manager, they are physically demonstrating the core principles of A. Active interpersonal communication strategies. B. Fundamental moral and ethical guidelines. C. Strict adherence to constitutional legal statutes. D. Comprehensive professional workplace behavior. Correct answer D. Knowledge point explanation. Core rationale. Professional behavior in the workplace encompasses a broad range of traits including reliability, accountability, and consistency. By knowing exactly what the management expects regarding attendance and workflow quality, and then consistently meeting those expectations every shift, the technician establishes themselves as a dependable professional. Trap analysis. Option A. While valuable, executing tasks silently does not constitute active communication, which requires a two-way exchange of information. This option would be correct if the scenario described the technician actively repeating verbal instructions back to a scrub nurse to ensure complete understanding. Option B. Ethics deal with distinguishing absolute right from wrong, whereas daily punctuality is a general professional standard. This option would be correct if the scenario described the technician refusing a request to secretly bypass a mandatory biological indicator test. Option C. Departmental expectations are internal employment policies, not government laws. This option would be correct if the scenario described the technician refusing to illegally dump untreated hazardous medical waste down a public sewer drain. Concept extension. True professionalism also involves continuous self-improvement, meaning the reliable technician should actively seek out cross-training opportunities to further increase their value to the department. Question 20. While actively striving to enhance their overall value as a healthcare employee and secure a permanent role within the sterile processing department, an entry-level technician must primarily focus their daily physical efforts on which foundational practice? A. Researching the academic prerequisites required to obtain a clinical master's degree. B. Drafting a rigid personal timeline detailing their expected supervisory promotion. C. Consistently exhibiting and maintaining professional standards of workplace conduct. D. Memorizing the complete historical timeline of all federal regulatory agencies. Correct answer C. Knowledge point explanation. Core rationale. Employability refers to the essential attributes that make an individual a desirable employee. The absolute foundation of employability in sterile processing is maintaining professional standards of conduct, which includes demonstrating a positive attitude, embracing teamwork, taking accountability for mistakes, and showing up ready to work safely. Trap analysis. Option A. Advanced collegiate degrees are not basic requirements for sterile processing roles. This option would be correct if the technician was actively transitioning out of the department to apply for a role as a hospital chief executive officer. Option B. Setting a promotional timeline is a goal planning strategy, but it does not make someone instantly employable on the floor today. This option would be correct if the technician was sitting down with a human resources mentor to map out their 5-year career trajectory. Option D. Rote memorization of agency history does not improve physical job performance or teamwork. This option would be correct if a college student was studying for a specific academic examination in a healthcare administration history course. Concept extension. Once a technician has established a strong foundation of professional conduct, they can further increase their employability by pursuing formal certification through recognized bodies like the Healthcare Sterile Processing Association. Question 21. While monitoring the environmental dials mounted on the wall outside the facility's sterile storage room where freshly processed orthopedic sets are kept, an SP technician must confirm that the heating, ventilation, and air conditioning system is actively maintaining which specific physical parameters? A. Negative airflow pressure with a minimum of 10 air exchanges per hour. B. Positive airflow pressure with a minimum of 4 air exchanges per hour. C. Positive airflow pressure with a minimum of 10 air exchanges per hour. D. Negative airflow pressure with a minimum of 4 air exchanges per hour. Correct answer B. Knowledge point explanation. Core rationale. The sterile storage room is a critical clean area designed to protect terminally sterilized packages from environmental contamination. To prevent airborne dust and microbes from entering when the doors open, the room must maintain positive air pressure pushing outward, combined with a minimum of 4 air exchanges per hour to keep the environment stable. Trap analysis. Option A. Negative pressure draws contaminated air into the room, which would compromise sterile packages. This option would be correct if the technician was verifying the environmental controls for the decontamination area where soiled instruments are washed. Option C. While positive pressure is correct, 10 air exchanges per hour is the standard for a different department zone. This option would be correct if the technician was monitoring the airflow parameters in the clean assembly and packaging area. Option D. Negative pressure combined with low air exchanges creates a stagnant, potentially contaminated environment. This option would be correct if the technician was measuring the airflow in a general soiled utility closet holding closed trash bags. Concept extension. In addition to airflow parameters, the technician must strictly ensure the temperature remains highly controlled and the relative humidity never exceeds 70% to prevent packaging materials from degrading. Question 22. While interpreting a surgeon's preference card requesting a customized gastroenterostomy tray, a new technician asks the preceptor why the letter O is physically inserted between the root words for stomach and intestine. The preceptor explains that this specific letter acts as a combining vowel to achieve what primary function? A. To alter the anatomical definition of the primary root word. B. To officially designate the phrase as a standardized surgical procedure. C. To facilitate easier vocal pronunciation of the complex medical term. D. To link two completely different and biologically unrelated organ systems. Correct answer C. Knowledge point explanation. Core rationale. In medical terminology, a combining vowel is a specific letter element placed between two root words or between a root word and a suffix. Its sole anatomical and linguistic purpose is to break up difficult consonant combinations, making the resulting word physically easier for staff to speak out loud. Trap analysis. Option A. Combining vowels do not change definitions or meanings of the roots they connect. This option would be correct if the preceptor was explaining the function of a prefix like hyperdash, which changes the meaning to excessive. Option B. Vowels do not classify or designate the type of procedure being performed. This option would be correct if the preceptor was teaching the definition of the specific surgical suffix ectomy. Option D. Combining vowels connect parts of a single term, not distinct unrelated systems. This option would be correct if the preceptor was describing the function of a vascular graft used to physically bridge two separate arteries. Concept extension. The letter O is the most frequently utilized combining vowel in surgical terminology, followed occasionally by the letter I, serving strictly as a phonetic bridge. Question 23. An SP technician is preparing a heavy, 40-pound rigid bin of bioburden-covered orthopedic retractors to be loaded onto a commercial transport truck traveling to an off-site sterilization facility 15 miles away. Which strict containment protocol must the technician physically execute before the driver takes possession of these specific items? A. The items must be terminally sterilized in a pre-vacuum cycle before leaving the hospital loading dock. B. The items must be secured inside rigid, leak-proof containers complying with federal transportation shipping regulations. C. The items should be transported in open wire carts covered completely with a single layer of clear plastic sheeting. D. The items must be manually scrubbed with an enzymatic detergent brush until visually clean before transfer. Correct answer B. Knowledge point explanation. Core rationale. Whenever contaminated medical instruments are transported on public roadways, they fall under the strict jurisdiction of the Department of Transportation. The technician must physically enclose these hazardous items inside secure, puncture-resistant, and leak-proof containers bearing prominent biohazard labels to prevent any public exposure to bloodborne pathogens during transit. Trap analysis. Option A. Contaminated items cannot be terminally sterilized without first undergoing extensive manual cleaning. This option would be correct if the technician was preparing a fully processed loaner tray to be returned to a vendor ready for use. Option C. Open wire carts with plastic sheeting offer zero protection against physical fluid leaks during a vehicle accident. This option would be correct if the technician was transporting clean, empty stainless steel basins down an internal hospital corridor. Option D. Thorough manual scrubbing is the primary function of the receiving facility's decontamination area, not the shipping dock. This option would be correct if the technician was standing at the 3-compartment sink actively starting the formal decontamination phase. Concept extension. Prior to closing the rigid transport bin, the technician must apply a point-of-use pre-treatment gel to the retractors to keep the gross soil moist during the 15-mile journey. Question 24. During a department renovation, an SP technician reviews the physical floor plan to verify that the newly installed pass-through windows and automated cart washers are oriented correctly. To prevent massive cross-contamination, the technician must guarantee that the physical movement of all surgical instruments strictly travels in which unidirectional sequence? A. From the sterile storage racks directly toward the active decontamination sinks. B. From the unrestricted public hallways into the semi-restricted clean assembly zones. C. From the clean assembly workstations directly toward the contaminated sorting sinks. D. From the contaminated sorting sinks directly toward the clean assembly workstations. Correct answer D. Knowledge point explanation. Core rationale. The most critical facility design rule in sterile processing is the one-way flow of materials. To contain microscopic pathogens, soiled instruments must physically start in the decontamination area and progress linearly into the clean prep and pack area, and finally into the sterile storage area without ever reversing direction. Trap analysis. Option A. Moving items from storage into decontamination transports clean items into a highly biohazardous zone. This option would be correct if the technician was tracking the movement of a utilized surgical tray returning from a completed operating room procedure. Option B. Hallway transitions describe personnel traffic flow boundaries, not the internal instrument processing workflow. This option would be correct if the technician was describing the physical location where staff must change into hospital laundered scrubs and don hair covers. Option C. Moving items from clean workstations backward into the soiled sorting area completely violates infection control principles. This option would be correct if tracing the directional flow of the HVAC air pressure cascade, which intentionally pushes air from clean spaces into dirty ones. Concept extension. The walls separating these zones must be solid physical barriers, and the pass-through windows must be designed so that only one side can be opened at a time to maintain the atmospheric pressure differentials. Question 25. An SP technician is standing at the brightly lit prep table physically inspecting a rigid fiber optic scope and several long, narrow biting forceps. The accompanying surgical preference card indicates these specific instruments will be actively utilized for an arthroscopy. Based on strict medical terminology, the technician knows these tools will be inserted directly into which anatomical structure? A. A patient's physical joint space. B. A patient's distended abdominal cavity. C. A patient's lower digestive tract. D. A patient's intracranial cranial region. Correct answer A. Knowledge point explanation. Core rationale. Analyzing the medical term identifies the exact surgical destination of the instruments. The root word arthro- translates to joint, and the suffix scopy translates to visual examination. Therefore, the technician knows these specialized tools are designed to visually examine and operate inside a skeletal joint, such as a knee or shoulder. Trap analysis. Option B. Operating inside the abdomen utilizes a completely different terminology route. This option would be correct if the technician was inspecting a laparoscope and a Veress needle intended for a laparoscopic cholecystectomy. Option C. The lower digestive tract requires much longer flexible instruments. This option would be correct if the technician was performing a leak test on a highly flexible colonoscope destined for a gastroenterology procedure. Option D. The cranial region involves penetrating the skull bone. This option would be correct if the technician was assembling a heavy-duty perforator drill and cranial rongeurs for a craniotomy. Concept extension. Because these rigid arthroscopic instruments feature tiny internal lumens and fragile fiber optic light cables, the technician must employ extreme physical care to prevent crushing the delicate glass fibers during assembly. Question 26. While packaging a heat-sensitive neurosurgical drill battery, an SP technician specifically selects a spun-bonded high-density polyethylene pouch, commonly known as Tyvek. The technician physically loads this specific packaging material into which type of sterilization equipment? A. A standard pre-vacuum steam sterilization chamber. B. A low-temperature vaporized hydrogen peroxide system. C. A liquid chemical peracetic acid processor. D. A traditional gravity displacement steam autoclave. Correct answer B. Knowledge point explanation. Core rationale. Spun-bonded high-density polyethylene is a plastic-based, non-cellulose material designed specifically to withstand deep vacuums and chemical interactions without absorbing the sterilant. It is the mandatory, validated packaging material required when physically loading items into a vaporized hydrogen peroxide or ethylene oxide low-temperature sterilizer. Trap analysis. Option A. Steam sterilizers operate at temperatures that will physically melt this plastic packaging onto the instruments. This option would be correct if the technician was utilizing a standard medical-grade paper and plastic peel pouch. Option C. Liquid chemical processors utilize specialized rigid perforated trays to allow fluid immersion, not sealed plastic pouches. This option would be correct if the technician was submerging an unwrapped flexible endoscope for immediate use. Option D. Gravity autoclaves utilize high heat which instantly destroys high-density polyethylene materials. This option would be correct if the technician was wrapping a heavy orthopedic mallet in woven muslin textiles. Concept extension. If a technician mistakenly packages a cellulose-based item, such as a cotton towel or paper pouch, into a hydrogen peroxide sterilizer, the cellulose will instantly absorb the sterilant gas and cause the machine's sensors to automatically abort the cycle. Question 27. After actively wiping down a blood-splattered intravenous infusion pump with an intermediate-level disinfectant wipe, the SP technician closely monitors the wall clock to ensure the device's physical surface remains visibly moist for exactly 3 continuous minutes. What specific physical metric is the technician actively enforcing based on the manufacturer's instructions? A. The mandatory thermal holding time. B. The minimum chemical activation period. C. The validated wet contact time. D. The baseline sterilization time. Correct answer C. Knowledge point explanation. Core rationale. Chemical disinfectants do not kill microorganisms instantly upon physical contact. The wet contact time is the exact duration, dictated by the instructions for use, that a surface must remain visibly covered in the liquid chemical to successfully breach the microbial cell walls and achieve the claimed level of disinfection. Trap analysis. Option A. Holding time applies to the temperature phase inside a steam sterilizer, not manual surface wiping. This option would be correct if the technician was monitoring the digital printout of a pre-vacuum autoclave maintaining 270 degrees Fahrenheit. Option B. Activation is the physical mixing of dormant chemicals prior to use, not the application time on the equipment. This option would be correct if the technician was pouring a specific buffer powder into a jug of glutaraldehyde to make it chemically potent. Option D. Wiping a pump with a disinfectant wipe does not achieve sterilization, which destroys all spores. This option would be correct if the technician was setting the cycle length for an ethylene oxide gas chamber. Concept extension. If the SP technician notices the infusion pump surface physically drying out before the 3 minutes have elapsed, they must immediately reapply a fresh disinfectant wipe to restart the timer and ensure complete microbial kill. Question 28. At the beginning of the morning shift, an SP technician opens the door of an inactive pre-vacuum steam sterilizer, reaches into the front floor of the chamber, and uses a brush to physically remove lint and tape residue from the drain screen. According to national standards, what is the minimum frequency the technician must execute this specific physical maintenance task? A. Following every single terminal sterilization cycle. B. At least once during every daily operational period. C. Once a week during the scheduled deep cleaning shift. D. Exclusively during the manufacturer's quarterly preventative maintenance visit. Correct answer B. Knowledge point explanation. Core rationale. The drain screen is the exit point for both heavy ambient air and condensate during a steam sterilization cycle, making it the coldest spot in the chamber. Because lint and debris naturally collect here and can cause catastrophic cycle failures, Standards dictate this screen must be physically removed and scrubbed clean at least daily. Trap analysis. Option A. Stopping workflow to disassemble the drain after every single cycle is operationally inefficient and not required by standards. This option would be correct if the technician was visually inspecting the door gasket for immediate cracks before locking the chamber. Option C. Weekly cleaning allows too much debris to accumulate, severely restricting critical air removal. This option would be correct if the technician was flushing the internal chamber walls with a specialized descaling chemical to remove hard water stains. Option D. Facility technicians must perform this daily task. It is not deferred to outside engineers. This option would be correct if the facility was actively replacing the sterilizer's internal pressure relief valves. Concept extension. A clogged drain screen prevents the dense, cold air from exiting the chamber, resulting in inadequate steam penetration into the instrument sets and leading directly to unsterile surgical trays. Question 29. An SP technician is physically pulling a specialized pelvic instrument tray from the sterile storage racks to build a case cart for an awaiting surgeon. The printed pick list indicates this heavy tray is required for a procedure involving the total surgical removal of a patient's uterus. Which exact medical term will be printed on the cart's dispatch label to identify this surgery? A. Diagnostic hysteroscopy. B. Total abdominal hysterectomy. C. Routine dilation and curettage. D. Bilateral salpingo-oophorectomy. Correct answer B. Knowledge point explanation. Core rationale. Processing personnel must decode medical terminology to ensure correct instrumentation is deployed. The root word hystero refers to the uterus, and the suffix ectomy refers to the physical surgical excision or removal of a body part. Combining these constructs, hysterectomy, the precise term for the complete removal of the uterus. Trap analysis. Option A. A hysteroscopy is the visual examination of the inside of the uterus using a lighted scope, not its removal. This option would be correct if the technician was dispatching a flexible camera and a light cable. Option C. Dilation and curettage involves expanding the cervix and scraping the internal lining, leaving the organ intact. This option would be correct if the technician was loading sharp uterine curettes and tapered dilators onto the cart. Option D. A salpingo-oophorectomy is the surgical excision of the fallopian tubes and ovaries, bypassing the uterus itself. This option would be correct if the surgeon specifically requested a tray tailored for removing solely the female reproductive adnexa. Concept extension. Identifying the correct procedural term on the pick list allows the technician to anticipate adding highly specific supplementary items, such as heavy-duty Heaney clamps or specialized abdominal retractors, to the surgical case cart. Question 30. An SP technician is participating in a departmental safety audit of all physical items stored in the active decontamination area. The facility auditor asks the technician to physically point to the one specific category of chemical supplies in the room that is not strictly regulated as a medical device by the United States Food and Drug Administration. Which specific item must the technician point to? A. A complex multi-part surgical instrument matrix. B. The dynamic air removal steam sterilizer machine. C. A sealed jug of orthothialdehyde high-level disinfectant. D. A bulk container of neutral pH enzymatic cleaning detergent. Correct answer D. Knowledge point explanation. Core rationale. The Food and Drug Administration regulates medical devices and products that directly impact patient health and safety. While sterilizers, instruments, and high-level disinfectants actively eliminate pathogens, general cleaning detergents are classified merely as environmental surface cleaners and are therefore regulated by the Environmental Protection Agency, not the FDA. Trap analysis. Option A. Reusable surgical instruments directly touch patient tissue and are heavily monitored by the FDA. This option would be correct if the auditor asked the technician to point to a Class 1 medical device requiring strict IFU adherence. Option B. sterilization equipment is classified as a Class II medical device subject to rigorous FDA manufacturing regulations. This option would be correct if the auditor asked to see the largest piece of capital equipment regulated by the government. Option C. High-level disinfectants interact directly with semi-critical devices intended for patient mucous membranes, placing them under FDA authority. This option would be correct if the auditor asked to see a chemical sterilant requiring daily minimum effective concentration testing. Concept extension. Although the FDA does not regulate the efficacy claims of enzymatic detergents, technicians must still rigorously follow the manufacturer's directions regarding dilution ratios and water temperatures to physically remove the bioburden necessary for subsequent sterilization to succeed. Question 31. While navigating the department's newly integrated instrument tracking software to locate a missing vascular set, the SP technician realizes this digital system drastically improves daily efficiency but inherently lacks which specific functional capability? A. Eliminating the need to repeatedly manually enter the same patient data. B. Consolidating and standardizing documentation to reduce conflicting surgical records. C. Automatically downloading and applying external industry standard revisions from regulatory bodies. D. Streamlining the physical workflow path to increase overall processing efficiency. Correct answer C. Knowledge point explanation. Core rationale. Computer integration in sterile processing streamlines internal workflows, reduces redundant data entry, and minimizes conflicting information by centralizing records. However, these systems are internally focused and do not possess the capability to automatically connect to external agencies to download or update critical industry standards. Trap analysis. Option A. Reducing redundant data entry is a primary benefit of integration. This option would be correct if the scenario asked to identify a major administrative advantage of the new software. Option B. Standardization of records is a direct result of computerization. This option would be correct if the technician was explaining how the system prevents two nurses from entering different names for the same tray. Option D. Increasing efficiency is the overarching goal of the tracking system. This option would be correct if the scenario asked for the broad operational purpose of investing in the technology. Concept extension. Technicians must manually review updates from professional organizations like the Association for the Advancement of Medical Instrumentation because internal tracking software cannot replace active continuous education. Question 32. During a mandatory departmental safety walkthrough, the SP supervisor asks a new technician to physically categorize the risks present in the decontamination area. While evaluating the space, which of the following risks must the technician correctly identify as a specific subcategory rather than one of the three primary overarching occupational hazard classifications? A. Ergonomic hazards related to repetitive brushing motions. B. Physical hazards from the extreme heat of the sterilizer doors. C. Chemical hazards resulting from enzymatic detergent splashes. D. Biological hazards stemming from residual blood on surgical trocars. Correct answer A. Knowledge point explanation. Core rationale. Occupational safety standards broadly group workplace risks into three primary categories: physical, chemical, and biological hazards. While ergonomic hazards, such as repetitive stress from manual cleaning, are highly prevalent in sterile processing, they are technically classified as a subset of physical hazards rather than a standalone primary category. Trap analysis. Option B. Physical hazards constitute one of the three main categories. This option would be correct if the supervisor asked for the broad category that encompasses slipping on a wet floor. Option C. Chemical hazards represent a primary overarching category. This option would be correct if the technician was asked to categorize the danger posed by a leaking ethylene oxide canister. Option D. Biological hazards are a primary overarching classification. This option would be correct if the technician was categorizing the risk of an accidental needle stick from a contaminated suture needle. Concept extension. To mitigate ergonomic subhazards at the sink, technicians should utilize anti-fatigue mats and adjust the sink height to maintain neutral posture during extended periods of manual scrubbing. Question 33. While working at the prep and pack station, an SP technician verbally explains a complex multi-part instrument assembly sequence to a trainee, utilizing distinct hand gestures to emphasize critical points, and then watches the trainee correctly execute the physical steps. This complete two-way interpersonal interaction physically demonstrates which specific process? A. Cross-functional team networking. B. The comprehensive communication cycle. C. Unidirectional public speaking. D. Standardized moral behavior reinforcement. Correct answer B. Knowledge point explanation. Core rationale. Communication is defined as the active two-way process of transmitting information and successfully achieving understanding between a sender and a receiver. By using spoken words and body language to convey instructions and then receiving confirmation through the trainee's correct physical actions, the complete communication loop is fulfilled. Trap analysis. Option A. Networking involves building broad professional contacts, often outside one's immediate department. This option would be correct if the technician was attending a national conference to meet sterile processing managers from other hospital systems. Option C. Public speaking is the act of delivering a monologue to an audience without a direct, immediate two-way exchange. This option would be correct if the technician was standing at a podium delivering an uninterrupted lecture to 50 nurses. Option D. Moral behavior involves ethical decision-making, not the mechanics of transferring instructional information. This option would be correct if the technician was teaching the trainee why it is ethically wrong to skip the leak testing step for a flexible endoscope. Concept extension. Effective communication relies heavily on nonverbal cues. In a noisy sterile processing environment, visual demonstrations and physical gestures often compensate for words lost over the sound of sonic cleaners and sterilizers. Question 34. An experienced SP technician voluntarily spends their afternoon shift physically guiding a recent hire through the intricate process of testing the insulation on laparoscopic graspers. Management observes this hands-on teaching interaction and recognizes it as which specific type of highly valued professional development activity? A. Mandatory annual competency discipline. B. A prerequisite behavior required for an automatic promotion. C. An exclusive management-only personnel evaluation. D. A positive mentoring behavior that builds departmental skill. Correct answer D. Knowledge point explanation. Core rationale. Mentoring is the act of a more experienced employee voluntarily sharing their knowledge and guiding a less experienced colleague. It is not a formal mandate or strictly reserved for management, but rather a highly positive, noticeable professional behavior that fosters teamwork and strengthens the overall clinical competency of the department. Trap analysis. Option A. Mentoring is voluntary and supportive, whereas discipline is punitive and corrective. This option would be correct if the technician was formally writing up the new hire for repeatedly violating the dress code policy. Option B. While mentoring is viewed favorably, it does not guarantee or serve as a strict prerequisite for automatic career advancement. This option would be correct if the scenario described the technician successfully passing the final examination to obtain their basic sterile processing certification. Option C. Peer-to-peer mentoring is common and encouraged. It is not restricted solely to supervisors. This option would be correct if the scenario described the department director conducting a formal yearly performance appraisal meeting in a closed office. Concept extension. Engaging in mentoring demonstrates advanced human relations skills and leadership potential, making the mentor a stronger candidate during future interviews for lead technician or supervisory positions. Question 35. While applying a specialized laser-etched barcode directly onto the metallic shaft of a highly expensive robotic grasper rather than merely scanning the exterior of the transport tray, the SP technician understands this individual tracking protocol is physically executed to achieve which specific operational capability? A. To guarantee the automated cart washer will run the exact appropriate cycle for that metal type. B. To instantly identify the precise physical location and specific tray assignment of that single missing device. C. To automatically bypass the manual inspection phase at the prep and pack workstation. D. To document that the instrument was processed using an ozone sterilization method. Correct answer B. Knowledge point explanation. Core rationale. Advanced tracking systems utilize individual barcodes or radiofrequency identification tags placed directly on high-value or critical instruments. This granular tracking capability allows technicians to locate a single missing item, determine exactly which compiled tray it currently resides in, and track its individual usage and repair history independently of the broader instrument set. Trap analysis. Option A. Cart washers do not read instrument-level barcodes to dictate cycle parameters. This option would be correct if the technician was pressing the specific pre-programmed button for an orthopedic cycle on the front panel of an automated endoscope reprocessor. Option C. No tracking system eliminates the fundamental requirement for physical, manual inspection of the instrument's functionality and cleanliness. This option would be correct if describing a hypothetical, currently non-existent technology that uses artificial intelligence to visually clear bioburden. Option D. The barcode identifies the instrument itself, not the exact chemical sterilization method required, which is dictated by the manufacturer's instructions for use. This option would be correct if the technician was checking the color change of a specific low-temperature chemical indicator tape. Concept extension. Individual instrument tracking is especially crucial for robotic instruments, as they have strict usage lifespan limits, e.g., maximum of 10 uses, that the computer system must tally to prevent intraoperative failures.